Hello guys, how are you doing today? My name is Ruben Gombalandi and today we're going to talk about cold injury. So what is cold injury? Cold injury simply means those injuries that would result from what cold as a result of what excess exposure, prolonged exposure to what to cold. Alright, basically as we know there are what two types of cold injury. We have what the freezing cold injury and the non-freezing cold injury. Talking about the freezing cold injury includes such injuries such as what the frostbite as well as what the frostning. But the non-freezing cold injury they include what injuries such as what the trench foot and also what the immersion foot. Understand? And another good example of the non-freezing what cold injury is not what the caliblane. Understand? Okay, basically in this particular chapter we're going to concentrate on what the frostbite. Okay, now what is the frostbite? Understand? But before we go into full details, I would like to give you guys a rundown on what we'll be dealing with. First of all, we're going to go into the definition of a frostbite. Of course, we need to know the meaning of the word frostbite, and also we are going to go into the developing factors of frostbite. We are also going to go into the classification of frostbite. We're also going to go into what we call the pathogenesis of frostbite. We're also going to go into what is known as the clinical manifestation of frostbite, as well as the general manifestation of frostbite. We're also going to go into the treatment of frostbite. Okay, like I was saying now, let's start with the definition of frostbite. As we all know, this particular word frostbite is a two-letter word disease actually. Consists of two words, which is the frost and the bite. Alright, now splitting these two words actually, you get a frost and a bite. Or what is a frost? A frost can simply be defined as a solid deposition of water vapor, understand, from humid air, understand. And basically a frost is usually formed on a solid surface. Mark my word, I use the word the frost is formed on a solid surface. In later time, you're going to understand why we use the word solid surface. Okay, now, what actually happened? Before a frost is usually formed, the temperature that is found on the solid surface must be lower or below the freezing point of water, and also it must be below the frost point, actually. Okay, alright, now, as we're saying, what is now the frost point? The frost point can simply be defined as that particular temperature where a gas changes directly into solid without passing through the liquid stage. Understand? Without passing through the liquid stage. Okay, now basically there is an analogy between the frost point and a sublimation. You can remember from high school chemistry that sublimation can be defined as the process in which a solid changes directly into vapor without passing through the liquid stage. But frost point, on the other hand, a gas changes directly into solid without passing through the liquid stage. So in both situations, the liquid stage it was skipped. Alright, now talking about bite. Oh my god, as we all know that a bite simply means a piercing or destruction of the normal anatomical layer of tissues in the body. Understand? It leads to the piercing or corroding or eating up of tissues is known as a bite. Understand? Alright, now combining the two words together, frost and bite, we have what we call frostbite. So now what is frostbite? Frostbite can simply be defined as the destruction or damage of tissues as a result of excessive exposure to low temperature, as well as other predisposing factors that can lead to tissue necrosis, as well as the aggravation of inflammatory reactive response. Understand? Alright, now basically, there are certain particular parts of the body that are mostly predisposed to frostbite. You can appreciate the fact that those particular parts of the body that are basically predisposed with frostbite are those parts of the body that are exposed to cold. Understand? And they include mostly the limbs. The limbs are basically predisposed to frostbite because they are the part of the body that are exposed to cold. Understand what I'm saying? Alright, like I was telling you before, we're going to discuss about some predisposing factors, or those factors that will help in the development of frostbite. Alright, like I was saying, we're going to discuss right now about what the factors that usually lead to the development of frostbite. Understand? And among such factors, it's obvious that that there is low temperature. Of course, even from the definition of frostbite, we said that it's a prolonged exposure to low temperature, which causes tissue damage. So the first factor that leads to the development of frostbite is low temperature. The second factor that lead to the development of frostbite is what we call what increase in humidity. Understand? Once there is increase in humidity, you get to understand that there is increase in the amount of moisture in the atmosphere. Understand? And if there is increase in the amount of moisture in the atmosphere, what does it mean? It means that the temperature of the whole surrounding will be very, very low. Understand? Which lead to the development of low temperature. And also you can appreciate the fact that increase in wind velocity can also lead to the development of frost, actually. Understand? But the last factor, which are like summarize the whole effect of the other factors, is when we have what we call tissue ischemia. What is tissue ischemia? Tissue ischemia just simply means decrease in perfusion of the tissues, actually. Understand? Once there is decrease in tissue perfusion, it is termed tissue ischemia. And this can come when there's increase in vasoconstriction, and also some behavioral patterns of people can lead to a decrease in tissue perfusion. So the behavioral patterns include behaviors such as wearing of tight clothes. Understand? Especially the ladies, they like wearing tight clothes. And also you can appreciate the fact that also, wearing tight shoes. Understand? If you wear tight shoes, that is decrease in tissue perfusion to those particular region of the body in which the compressed part of the shoe has is compressing the artery that supplies that region of the body. Therefore, you develop what we call local ischemia, local tissue local tissue ischemia, basically. You understand what I'm saying? Okay, once an individual develops what we call a local tissue ischemia, what next? It leads to necrosis, man. Because since the tissue around that region cannot get a good arterial supply of blood, they begin to undergo necrosis. Understand? They undergo necrosis, basically. And this leads to development of frostbite, because we've defined frostbite as damage of tissues, not only because of low temperature, but also because of other predisposing factors, which we just discussed right now, apart from low temperature. You understand what I'm saying? Alright, now, as I told you, we're going to talk about what we call the pathogenesis of what's called frostbite. You understand? Alright, basically there are about 3 theories that help to explain the pathogenesis of frostbite. The first among them is the first theory postulates that frostbite usually develop as a result of low temperature. Alright, let me just give you a very good example to explain this theory to you. Now, you imagine yourself, you are in you are outside and it's winter. You understand what I'm saying? If it is winter, it means the temperature outside, understand, is very low. Understand? Alright, first, what actually happens when you are outside, you understand, at the moment in which you step into the external environment, you don't the level in which you feel cold is you don't start feeling cold instantaneously. Thank you, Pedro. You don't start feeling cold instantaneously. But what actually happens is that after a certain period of time, you start experiencing a very high degree of cold. You understand? You get so cold, you get so cold. So what is the mechanism? That's what we're trying to explain right now. Alright, what actually happens is that since the weather is very cold, it means that the level of moisture is high. You just remember the factor we mentioned. Increase in humidity lead to formation of frost disease. Okay, now have it in mind that there is increase in humidity. Understand? Okay, if there is increase in humidity, it means that the air has increase in the amount of moisture. Okay, and your body temperature at that point in time is higher compared to the surrounding. So what actually happens is that when the air comes in contact with your skin, understand, it usually takes up, that's what we call heat of vaporization, latent heat of vaporization. It takes that latent heat of vaporization from your skin. Understand? When it takes the latent heat of vaporization from your skin, it now vaporizes. Understand? But you agree with me that in as much as you are standing in that cold region, you understand, there is continuous uptake of latent heat of vaporization from your body. And what actually happened? What is the consequence of that one? It simply means that what, as far as what you are losing heat, as far as the surrounding air, the use of your heat as in the form of what, latent heat of evaporation, it means that what, the temperature of your body becomes, it keeps on what, decreasing, it keeps on decreasing, it keeps on decreasing. It will now reach to a point where what, where the temperature of your body is below what, the freezing point of water, as well as what, below what we call what, the frost point. Understand? At that point in time, understand? At that point in time, the incoming what vapor, in the incoming what vapor, once they come in contact with your body, they no longer evaporate because the temperature of your body is very low. Understand? It's very low, and once they come in contact with your body, they now form what we call the frost, man. They form the frost. Why? Because a frost is formed when the temperature of the solid is what, lower than what, the freezing point of water, as well as what, lower than the frost point. So at that point in time, the temperature of your body is very low. Understand? And so therefore, once they come, they form the frost. Understand? Now, this is what this particular theory of what, formation of frost, according or as a result of low temperature, is it tries to postulate. Do you understand what I'm saying? Alright, the second theory is known as what we call the neuroreflex theory. Understand? This particular neuroreflex theory is based on what we call the hyperactivation of what, the sympathoadrenal system. Understand? Okay, once the sympathoadrenal system is hyperactivated, what does it do? It leads to what increase in vasoconstriction. Understand? Once there is increase in vasoconstriction, what happens to tissue perfusion? There is what, decrease in tissue perfusion. Understand? Because once the vessels are vasoconstrict, understand, the tissue now have what, decreased arterial supply. Understand? And mind you, what do we define what frostbite as to be as what? We define frostbite as what, those factors that would predispose or that facilitate what, necrosis. And what, you can agree with me that what, decrease in tissue perfusion are due to what, vasoconstriction, usually what, enhance what, necrosis. Understand? The development of what, necrotic what, tissues. Understand? All right, now. The third theory, you understand, is somehow related or synonymous to the second theory, you understand, because it's like it's trying to explain more on what the second theory, you understand, which is what the theory of what neuroreflex or theory actually. So the third theory has to do with what, it postulates that what what's it called, frostbite usually occurs due to a decrease in what, tissue perfusion, just like we have just said in the second theory actually. You know, basically these all three theories, they are what, intertwined. They are intertwined. The first one, understand, has to do with what, once there is decrease in what temperature, normally what do you expect the body to do? The body, understand, the blood vessels, understand, they will try to vasoconstrict. Once they vasoconstrict, they do that so as what, to conserve heat, because you are in an atmosphere of low temperature. So the blood vessels, they must what, vasoconstrict, so they will conserve your heat. Understand? Because you are meant to be what, a warm-blooded animal. Understand? Since you are a warm-blooded animal, the body need to maintain a temperature irrespective of what the changes in the external environment. Understand? Okay, now. Once there is vasoconstriction, understand, there will be what, increase in what, sympathoadrenal system. If there is increase in sympathoadrenal system, what do you expect? What will happen next? There will be decrease in what, tissue perfusion. So all these things, they are intertwined together. All these things are related. You understand what I'm saying? So basically, the theory of the pathogenesis of frostbite, they are all intertwined together. The first one, the first theory leads to the second theory leads to the third theory, understand? So basically right now we are going to go into what is known as what, the clinical manifestation of what, frostbite. Alright, now talking about what, the clinical manifestation of what, frostbite. It simply means if a patient should present, should come to you, understand, on what are the signs that you're going to see, so that you can be able to assess the level of damage which was done by what, the cold in which the patient was exposed to. So first of all, you have to understand that there are what, 4 four basic stages or degree of what clinical manifestation. Understand? All right, now we have patient. Patient could be in a first degree, second degree, third degree, or even fourth degree. Understand? All right, now there are specific signs which are associated with these particular degrees, and it is important for what a doctor to know those particular signs. All right, now a patient who is in the first degree, first of all, is going to have a local loss of sensitivity. Understand? There's going to be a local loss of sensitivity, which simply signifies that what the nerves at that particular region are affected. You understand what I'm saying? All right, now the second sign of a patient at the first degree, you appreciate the fact that the skin around that same region, understand, they will be pale. He's going to have a pale skin, understand, and that the paleness of skin would later change into redness, understand. So that means there will be first of all, there will be a formation of a pale skin, and then afterward, that region of paleness will turn into redness, understand. And the third sign of a patient who is on the first degree, you can appreciate the fact that the skin of that patient will experience what is known as cyanosis. Understand? Cyanosis is just nothing but the blue or purple discoloration of the skin. Understand? Why? Because the arterial supply at that particular point, at that particular region of the skin is affected. Understand? Therefore, there is neither inflow or outflow of blood. Therefore, you have to experience cyanosis. You understand what I'm saying? Okay, now a patient on this who is at who is in the second degree of frostbite, you can see you can observe that at that particular point in time, at that particular region of the skin, there is just a decrease in sensitivity. Mind you, in the first stage, you understand, or in the first degree, there's a total loss. It's a total loss, understand? But in the second stage, there's a decrease in skin sensitivity. Understand? And also, there's also skin the formation of a cyanotic skin. Understand? The patient will have a cyanotic skin. Understand? And in this particular third stage, second stage, understand? There is also what we call a formation of blisters. But mind you, these blisters, they have what is known as a serous hemorrhagic fluid in them. Understand? It simply means that they contain serous fluid which is mixed with blood. Once you observe the blisters, and a patient in the third stage, it usually has what we call blisters. The patient has blisters also. So a patient in the third stage has blisters. A patient in the second degree has blisters. But there is a difference between a patient in the third stage and a patient in the second degree. A patient in the third degree usually is characterized by the possession of what is known as the sequestration of necrotic tissues. It simply means at the third degree there is accumulation of necrotic tissues. Understand? And this particular third degree, it usually heals after about 30 to 45 days or so. Understand? But this particular second degree, it heals after 2 to 3 weeks basically. But a patient who is at the first degree, it usually resolves itself after about 4 to 6 days. Now, the fourth degree of frostbite is in the first degree. A patient who is in the fourth degree will have what we call the damage of all layers, including the bone at that region. Even the bones at that region where the frostbite is affected is manifested will be affected. You understand what I'm saying? And also, there's going to be a marked appearance of a dry gangrene. You understand? At the fourth degree, that's when you see a dry gangrene. Understand? So mind you, what we've just discussed right now is the clinical manifestation. Understand? But right now, I want us to look into what is known as the clinical stages of frostbite. Understand? And in the clinical stages of frostbite, at the first stage, of course, in everything, there will always be number one. There will always be somebody wants to take always the first position. So at the first stage in frostbite is known as the latent period. Understand? Now this latent period is nothing but the period from the onset of cooling to the onset of warming. Understand? The interval between the starting of cooling and the starting of warming is known as the latent period. Understand? Okay, after the latent period, you have the reactive period of frostbite. Understand? The reactive period of frostbite is just a period after warming. You understand? Normally, if you step out in the cold and you get back to your room, the first thing you do is what? To mount into your blanket and what? Get some heat. Understand? So what you're actually doing, if you are actually suffering from what? From what we call frostbite, so we can decide to it's actually an analogy. You use this analogy as when you are in your blanket. You understand? That is your reactive period. Understand? The reactive period is after what? Warming. It's after warming. You understand what I'm saying? Okay, now we have now after the reactive period, we have what we call the first phase of what? Frostbite. Understand? In the first phase of frostbite, that's why you appreciate what? The presence of what? Inflammations. You get inflammation during the first phase of frostbite. Understand? In the second phase of frostbite, at that point in time, that's why you appreciate what? The development of necrotic tissues. And the development of this particular necrotic tissue is what? Localized in a particular region. Understand? It's localized. It's not actually a general necrosis. Understand? Alright, now the last phase, understand, which is the phase, the third phase of what? Frostbite, is where you have what we call epitheliation and also what? Formation of what? Scars. Alright, fellas, now we're going to talk about the treatment of frostbite. Basically, you know, in everything, every human being wants a solution to his problem. So that is all this thing we've been saying will be useless if we cannot actually render help to the patient. So how do we treat frostbite? So basically, the frostbite is treated in the same way as if you are treating what we call an obliterating vascular pathology. Understand? Alright, basically, you can also administer what we call an antitetanus serum to the patient. Understand? Because you can agree with me that during the fourth degree, understand? During the fourth degree of the clinical manifestation of frostbite, there you can appreciate the formation of what? Dry gangrene. Understand? So it is very, very important for you to administer an anti-tetanus serum if you should ascertain that your patient is actually in the fourth degree level. Understand? All right. You can also do everything possible, medically possible, to bring about what? The restoration of what? Microcirculation. This you can do by administration of what we call peripheral vasodilators. Understand? Such as what? Spasmolytic drug, thrombolytic drugs, and you know those things that will lead to what? Those particular drugs that will lead to what? To the restoration of what we call microcirculation. Do you understand what I'm saying? Okay, now. This is just, you can also administer with antibiotics also. Antibiotics also could render a good help also. And also you can also detoxification could also it will be helpful actually. Detoxification is also very, very important actually. Alright, also now talking about what this is just like an overview of what the treatment of what? Frost disease. Understand? Alright, now they are all called local treatment. Understand? Okay, what this local treatment has to do with what? The treatment on a very, very serious ulceration due to frostbite. Understand? How did you manage such cases? Understand? Okay, first what you need to do is what? You have to irrigate the whole region. Understand? You have to basically wash the region with what? Antiseptic solution. Understand? After washing the region with antiseptic solution, understand? What do you do next? You carry out an incision, an antiseptic incision of what? The blisters. Because normally at a very chronic, at a very advanced stage, understand? You appreciate the formation of what? Blisters. Understand? There is also what? There is the formation of what? Blisters. So at this point in time, you have to what? Make an antiseptic incision, and also what? You also make an antiseptic what? Packaging of the whole side. First you incise and then you package it after that. Then after in your incision, you carry out what? A necrectomy and also a necrectomy. Basically, understand? And if you see if it's very, very advanced, then actually amputation of the whole limbs will be very, very it becomes what? Necessary, of which basically as a medical practitioner is our last resort. Alright guys, thank you very much for your attention, and I hope you guys enjoyed this lecture. Okay, you guys just watch out for much more interesting as well as what? Very serious topic and the next upcoming videos. But for now, it's me, Ruben Gombalandi, signing out. So have a nice day and be good.